Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Welcome to the Stem Cell Healing Institute podcast. We are here with Dr. Zahra Figueredo. How are you, doctor?
Very good, Luis. Thank you so much. How are you doing today?
I'm doing great.
Good.
Doctor, we do have a very interesting topic. We are going to talk about temporomandibular joint, also known as TMJ for future reference.
Correct.
And there is a very common condition that is rarely mentioned, right, doctor?
Yes. In the context of stem cells, it's very rarely mentioned. However, it is a very, very common condition that can be caused from caused from some sort of accident or injury, somehow direct damage to the joint, or just normal wear and tear. But yes, very, very common, very rarely mentioned in the realm of stem cell treatment.
So for people that don't know the temporomandibular, it's so hard for me to say.
It's difficult for most.
Temporomandibular joint.
Yes.
What is it about? Where is it located?
Okay. So right in front of the ears. If you open and close your mouth, you will feel that little sort of click and sliding of the jaw and basically that gliding of the jaw with the rest of the skull is the joint. You can feel it as you open and close your mouth.
Mine cracks.
Yes.
Sometimes.
Yes.
And I don't know if it's because I got into a lot of fights when I was young.
That's probably it. Yes. So direct injury is usually the number one cause. Some sort of injury, even like things like whiplash can cause it. So being rear-ended or T-boned or whatever the injury, or being in too many fistfights, or yes, being hit in the head or the face. Very, very common, and most people don't start to actually experience problems until later. Very much like any joint injury.
It's like a dislocation of the jaw as well.
It can cause dislocation. Dislocation can cause the injury as well, like vice versa. And then, yes, and just wear and tear. And yes, the dislocation of the jaw, which causes further wearing of the joint and the disc and the cartilage. So, and then also, we want to also not forget to mention that in temporomandibular disorders, TMD, it also includes the other connective tissues that sort of surround the TMJ, the joint. And that can include the muscles of the neck, the muscles of the jaw, as well as ligaments and tendons that sort of connect everything together. So sometimes you see the wear and tear of those tissues as well, and tensing and so on.
So now at the moment, what is the most common treatment for TMJ?
Yeah, so there's prolotherapy, which is an injection of, it could be any various type of fluid that's injected in order to pretty much doctors are trying to cause an irritation to induce the inflammatory cascade. So that can be effective, perhaps only temporarily. Then there's arthrocentesis, which is again an injection of a fluid to help move things into place, perhaps remove any debris that may be causing issues and inflammatory factors that may be causing inflammation. And then there's our arthroscopy, which is a visualized sort of cleaning of the area, as well as implants, like full-blown implants and surgery. So those are sort of the most common methods of treatment, which usually tend to be temporary, or in the case of implants, very, very invasive.
So how can the stem cells help to treat this instead of going for the a typical treatment?
Yes, the downtime with stem cells is a day or two, if any, very little. And when I say downtime, it just means that just not opening and closing the joint to a huge degree, like trying to bite into a triple-decker burger or something is a no-no for the first day or two. But after that, the goal is that you can open your mouth wide enough to get that burger in. But hopefully you're doing it in a wise way. But yeah, so the goal with stem cells is to literally regenerate the joint, okay? Because there's been degeneration in the joint, there may be tissue to injury to the tissues surrounding the joint. That could be the cartilage, that could be the disc itself, that could be the bones, it could be the ligaments and tendons, it could be the muscles that also allow for the opening and closing of the joint. So basically regenerating the damage and undoing the damage in order to restore normal function, which again could mean opening and closing widely without locking, without pain. Pain is the huge, the most important factor. Restoring circulation, to allow the blood to get in, so nutrients and endorphins can come in and eliminate pain as well, and also restoring the nerves that have been damaged. So there's also nerve damage in many cases with TMJ. So regenerating and restoring the nerves that have been damaged in the process, and again eliminating pain in that way, because the pain essentially starts from the damage to the nerves.
This will improve with the mobility as well, right, doctor?
Yep, absolutely, yeah. So that's why I used the burger as an example. So opening, a lot of patients have so many issues opening wide, or when they go to the dentist and it literally locks until it's manipulated back into place. So yes, it could be very, very painful and diminish quality of life for many patients.
Would this be helpful for increasing the blood flow?
Yes. And because stem cells, and we mentioned this in a previous podcast about methods of deployment. So when we do the local injections, it's really important for us to do the IV as well at the same time, because we get the stem cells locally into the circulation, but also through the IV everywhere the blood flows. So if there's any area we missed with the stem cells, it's still going. The stem cells will still get there through the blood and increase circulation, increase angiogenesis, which is increasing the numbers and blood vessels, making it more permeable, making it more beneficial in that way that the stem cells get to everywhere we're injecting and everywhere the blood flows.
I see, doctor. And I do have to ask you, for all those new listeners, you do these treatments in Guatemala City, right?
We do this treatment in Guatemala City because we cannot do it in North America. Canada has completely outlawed any version of stem cells, and in the US, there is a very limited version of stem cells, but with a lot of limitations that really inhibit the best results. So we are in Guatemala. That allows us to be able to freely, very safely and ethically do these stem cell treatments in a very effective manner and with ethical prices as well.
And how long will be the downtime in this condition, in this specific condition?
So really, there's not much downtime. It would be a matter of maybe a liquid diet for a day, just so that they're not opening, or very soft food diet, so that there's not too much movement in the jaw for a day or two. We do want movement, but not to a huge degree. And then after a day or two, there's really no and nothing inhibiting a normal lifestyle.
So after you do this treatment, doctor, when can we say the patient will start seeing the benefits of the stem cells?
We have seen results within days to weeks to months. The general rule of thumb, as I've said in the past, is about 3 months, okay, for full regeneration and repair to take place. Regeneration and damage to tissues or undoing a damage to a tissue and just building it back up, reconstructing, it takes time. Okay. So when it's done correctly, so that the cells to grow and to renew and to construct. So anywhere from a few weeks to a few months. Again, general rule of thumb being about 3 months to really see the full effects of the treatment.
So, doctor, would you be needing any x-rays or any type of test before the patient comes?
Yeah, so in general, we require some blood work, okay, to ensure that the patient is healthy enough to forego and undergo the stem cell treatment, making sure there are no other limitations that we need to be aware of, number one. And then number two, in this case in particular, and in a lot of orthopedic type conditions, we do like to see images that could be x-rays, it could be MRIs, it could be a CT scan, something where we can really visualize where the damage is and what we need to address in terms of undoing the damage and addressing it with the stem cells correctly.
Doctor, you being a Canadian, what do you think about Guatemala?
Guatemala, I was actually pleasantly surprised with the first time I came to Guatemala. It is a beautiful tropical country. It's a destination spot where a patient can very easily turn it into a beautiful vacation. We have beaches, we have coffee farms, we have volcanoes, we have Mayan ruins. It is quite an incredible country. And I would highly recommend that if a patient comes for treatment, to take a few extra days to do some sightseeing because it's well worth it. I have never ever had any kind of negative feedback from a patient that had never come to Guatemala previously. So that's something to definitely keep in mind. And also for our patients, bear in mind that our treatment package includes all of the pre and post treatment protocol that I've mentioned in past podcasts, but also we do include accommodations in a very, very comfortable apartment type of a facility, as well as a personal driver for airport transfers and errands and appointments and things like that. And we just try to make your visit as seamless and as comfortable as possible.
So, as a Canadian, again, what are your favorite places here in Guatemala?
Oh, wow. I would say Antigua it's a UNESCO World Heritage site, beautifully restored and maintained. So Antigua would be one, definitely Lake Atitlan. There are some beautiful areas around the lake that are really, really absolutely worth visiting. And then the volcanoes, where you can literally trek up the active volcanoes and roast marshmallows in the lava. It's quite phenomenal. I've done that. And I haven't been to Tikal yet, which is a ruin.
Wow, you haven't gone there.
Not yet. I have to go. And that's where a part of Return of the Jedi was filmed. And that is somewhere I can't wait to visit.
All right. So you got to do some planning to go to Tikal, Doctor.
That's right. That's right. And I also heard that the windy road down the cliffs leading to Panajachel, which is at the lake also, was featured in the Fast and the Furious, one of the Fast and the Furious of the series. So that's quite interesting too. And I have been down that windy road.
All right, Doctor. Well, we really appreciate your time, Doctor. And do I need to ask you anything else?
No, I think we've pretty much covered everything for this episode. Luis, thank you so much.
Okay, you have a great afternoon.
You too.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI, on Spotify, Stem Cell Healing Institute, on YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.